Very good afternoon to one and all. Today I'm going to present a paper on the study of association between allergic rhinitis and adenotonsillitis. Allergic rhinitis and adenotonsillitis are most commonly encountered diseases in ENT OPD, and allergic rhinitis affects 10 to 25% of the world population and 20 to 30% of Indian population. This allergic rhinitis is a common chronic nasal disease presented by symptoms of sneezing, rhinorrhea, itchiness, and nasal congestion. It is an immunological inflammatory reaction as a result of exposure to certain antigens and occurs because of a complex interplay between genetic and environmental factors. And allergens like vehicle exhaust, the use of incense sticks and mosquito coils, pollens, and fungal spores are commonly encountered in India. Whereas in tonsils and adenoids physiologically serve as a defense mechanism against inhaled antigens, and they are deeply involved in the innate and adaptive immune response because of their peculiar position at the entry of the upper aerodigestive tract. The aim of this study is to study the association between allergic rhinitis and adenotonsillitis and to study the demographic and epidemiological factors associated with it. So it is an observational study done at Department of ENT at Tertiary Care Center in a duration of 6 months. The sample size is 75. It is an universal sampling method, and patients visiting ENT OPD with symptoms of either allergic rhinitis and or adenotonsillitis were included in this study. And unilateral tonsillar swelling and suspected malignancy, allergic rhinitis with previous adenotonsillectomy and during pregnancy were excluded in this study. So ethical committee clearance was obtained and participants' informed consent was taken, and all the study participants underwent detailed history about the symptoms. Clinical examination was done. The score for allergic rhinitis, which is SFAR questionnaire, were asked for the diagnosis of allergic rhinitis and further classified by area. This SFAR questionnaire contains 8 items, each given a score, and the total score is 16 with a cutoff score of 7 and above for definite diagnosis of allergic rhinitis. So diagnostic nasal endoscopy was done. Total eosinophil count for suspected allergic rhinitis. Brodsky grading for tonsillar hypertrophy and Clemens and McMurray grading, which is the endoscopy grading for adenoid hypertrophy, were done accordingly. And these data were collected in pre-structured for pro forma and analyzed with appropriate statistical tests. And on coming to results, out of 75 patients, total of 55 patients belong to the age group of 5 to 25 years of age with female predominance, and most of them belong to upper lower class. And most of the patients were students and according to area classification, moderate to severe intermediate is the most common type, and more than 6% eosinophil count was found in 20 patients. And in Brodsky grading, grade 3 tonsillar hypertrophy were most common, and adenoid hypertrophy grade 2 were the most common. And in diagnostic nasal endoscopy, inferior turbinate hypertrophy with pale mucosa were most commonly seen. Out of 75 patients, 21 patients have an SFAR score greater than or equal to 7 with female predominance, and out of these, 16 patients have adenotonsillitis. So the chi-square test showed that allergic rhinitis was significantly associated with all the questionnaires, and score less than 7 but having allergic symptoms also indicate their susceptibility to allergic rhinitis. In our study, allergic rhinitis was more commonly encountered in children and young adults. The same findings were noted by Nicola S. et al. And the chi-square test also showed that allergic rhinitis was significantly associated with all the questionnaires. These were noted. Nicola S. et al. Also noted similar findings. However, Kopacheva et al. Noted that there is no specific association, but allergy seems to be the risk factors for adenotonsillitis. On conclusion, as allergy mainly involves the upper respiratory tract, it potentially triggers the adenotonsillitis, and it is significantly associated with demographic and clinical features. And by reducing this exposure to allergens, it may be possible to reduce the risk of adenotonsillitis, and consequently, it will improve their physical growth, mental health, and also reduce the need for adenotonsillectomy. These are the references. Thank you.
I request Dr. Bhalchandra Paike sir to hand over the certificate to Dr. Lalrinsangi. Next, Dr. Vandini Sharma. Is she here?